Good afternoon, everyone. So I'm Priyanshi and I am SR ENT. I will be taking your first ENT class today. Since you guys haven't had any ENT class, first I'll give you a very brief overview of what will you be learning in ENT. So, like the name says, it's ear, nose, and throat. Along with that, we have a comprehensive head and neck examination included in your course as well. Right, so we have ear. Ideally every time we start with ear, but since you guys had your छुट्टी or whatever, तो आपका ear अभी miss हो गया है. So ear and nose we'll cover separately later. So ear, nose, throat, larynx, head and neck. This is basically what your curriculum is, and then we go into details of every topic. So we are today starting with anatomy of neck, and you must have read about the anatomy of neck in your anatomy classes also. See, if you have something to say, then get up and say. Otherwise, don't keep murmuring because it's very irritating. How come? If you don't want to study also, you can tell me, I'll go. I'll take your attendance and go. So I won't waste your time. You guys don't waste my time. We have a lot of work. You want to study, listen to me carefully. If you don't just say we don't want to study, you can walk out also anytime. It's completely fine. Just don't keep doing at the back of the class. It's very irritating. And we've also done our MBBS. We've done our post graduation. We've been through it all. Okay. So, anyways, continuing with neck. Ear is the most important aspect of ENT, which will come in your clinics also, which will come in your theory lecture also. Second, nose, then throat, then neck. So today, I don't know how, but we're starting with neck since that's what your new curriculum is. Right, so neck, ideally, if you talk about any anatomical structure, we always have boundaries, right? So we have an anterior, we have a posterior, we have superior, we have inferior, and that defines pretty much what organ you're talking about or what structure you're talking about. So when we talk about neck, superiorly, the limit of your neck is mandible. Anteriorly, when you go posteriorly, the limit becomes your base of skull. And inferior most limit of your neck is clavicle. Yes. So clavicle is your inferior most limit of the neck. Now you must have read in your anatomy classes the neck is divided into anterior triangles and posterior triangles. So in today's class, what we will cover, we'll cover the triangles of the neck. We'll talk about the most important part, which are the lymph nodes of the neck. So every lymph node has a level, and that decides what course of the disease we are talking about. So why neck nodes are important? Because when we deal with oral cavity malignancies or when we deal with any malignancy of the head and neck, it classically drains to your neck nodes, and those neck nodes are present in the neck at various levels. So first we'll understand the triangles of the neck, then we'll understand about the lymph node levels, and then we'll see what is the clinical significance of having those levels and what will we do about it later. Okay, is it clear up till now? So quickly we'll talk about the triangles because you all know. So neck is divided into anterior triangle and posterior triangle. These are the landmarks which you all know. So I'll skip. Now this is the basic slide through which we'll talk about everything. So our neck is divided into anterior triangles and posterior triangles. Now anterior triangle again has 4 different sub-triangles. So anterior triangle has an anterior margin which is your midline. Posterior most is your anterior belly of sternocleidomastoid. Superiorly you have mandible and inferiorly there's clavicle, right? Now this anterior triangle is divided into 4 different triangles. There is submental triangle, there's submandibular triangle, which is also known as your digastric triangle. Then there's your carotid triangle and muscular triangle. Okay? So we'll talk about each triangle in detail. Submental triangle is, where is your submental triangle? This is your submental triangle. Okay? So submental triangle का medial border क्या हुआ? Midline. And the lateral border is anterior belly of digastric. And your upper border is mandible. So this is your submental triangle. Then comes your digastric triangle or submandibular triangle, in which your anterior and medial boundary is anterior muscle of sternocleidomastoid. So digastric. I don't have a pointer here, but if you can see the figure A, that A उसका जो anterior border दिख रहा है towards the medial side, that is your anterior belly of digastric. Posteriorly, what you see, that is the lateral midge, which is your posterior belly of digastric. Okay, superiorly you can see there's mandible, and then niche there's hyoid, right? So this is your submandibular or your digastric triangle. Why do we call this a digastric triangle? Obviously because it's bounded between two digastric muscles. Now if you see, there's a D is the muscular triangle. So muscular triangle ka boundaries is midline. When we talk about the internal boundary, it becomes your strap muscles, and lateral boundary is anterior border of sternocleidomastoid. Then the C is your carotid triangle. Carotid triangle is between the strap muscles and posterior belly of digastric and anterior border of sternocleidomastoid. So the content of carotid triangle is carotid sheath. And what are the contents of carotid sheath? There's common carotid artery, which is dividing into internal and external. There's internal jugular vein. There's vagus nerve, sympathetic trunk, and ansa cervicalis, right? So that is your content of carotid sheath, which is the content of carotid triangle. Now all these four triangles are anterior triangles of the neck. Now when you see the E and F written over there, those are the posterior triangles. Posterior triangle by and large is divided how? Anteriorly there's sternocleidomastoid, posteriorly there's anterior border of trapezius, and inferiorly there's clavicle. Superiorly the two muscles unite and they join at the base of skull. So we have base skull, trapezius, sternocleidomastoid, and clavicle. This E and F is now further divided by the posterior belly of omohyoid. Can you see the small muscle which is right over here? Which is the inferior belly, right? So superior belly of omohyoid and inferior belly of omohyoid. Here, inferior belly of omohyoid is dividing the posterior triangles into two triangles. F is your supraclavicular triangle and E is your occipital triangle. Now, so you know the contents and the boundaries of each triangle. There's anterior and there's posterior, right? Now we'll come to the more important part of this anatomy, which are the lymph nodes. So there are basically seven level of group of lymph nodes. There's level 1A, there's 1B, there's 2A, 2B, 3, 4, 5A, 5B, 6, 7, right? Now, why am I labeling these lymph nodes? Because there are close to 200 lymph nodes on each side of neck. So roughly about 300 to 400 lymph nodes we have in the neck. Now we can't possibly name each and every lymph node. So what we do, we divide them on the basis of their location and their anatomy into a group. So that is why each group is now a level. Now depending on the anatomy and which part of the particular oral cavity or head and neck is draining, it becomes a level, right? Now we spoke about submental triangle. There is level 1A group of lymph nodes which are known as submental lymph nodes. So submental triangle का content क्या है? Submental lymph nodes, which is level 1A. Is there any other structure in submental triangle? They're just soft tissues, muscles, and lymph nodes. So for clinical significance, we have lymph nodes, which we now call 1A. Okay, now what is 1B? 1B group of lymph nodes are the ones which are present in your digastric triangle. So the content of digastric triangle, more importantly, there is submandibular gland, there is facial nerve, there's facial artery, there's facial vein, and then there are lymph nodes. So those lymph nodes which are present in your 1B, they are your level 2 or digastric group of lymph nodes, right? Now level 2 क्या होगा? Level 2 will be the one which are present behind the posterior belly of digastric and in front of your trapezius. So that, and now superiorly we have skull base, and inferiorly now you draw an imaginary line from the hyoid. So what is your marking now? Superiorly there's skull base, inferiorly there's an imaginary line which is crossing your hyoid, anteriorly there's posterior belly of digastric, and posteriorly there's anterior border of trapezius. That group of lymph nodes is known as level 2. So any number of lymph nodes that are present in this particular anatomy is level 2 group of lymph nodes. Now this level 2 is again divided into 2A and 2B. Now which organ divides it into 2 and 2B? There's spinal accessory nerve which passes between this. So spinal accessory nerve classically traverses through your sternocleidomastoid, right, from its posterior border. So it comes through it and then it goes superiorly. So स्पाइनल एक्सेसरी नर्व के आगे जितने भी लिम्फ नोड्स होंगे दोज आर योर लेवल 2A, एंड स्पाइनल एक्सेसरी नर्व के पीछे जो भी ग्रुप ऑफ लिम्फ नोड्स है दोज आर योर लेवल 2B. ठीक है. Now when see we drew an imaginary line from the hyoid. Now you draw another imaginary line from the cricoid cartilage. So anatomically those lymph nodes which are present between the hyoid and the cricoid, anteriorly obviously there are strap muscles and posteriorly there is trapezius. So all those group of lymph nodes now they are level 3. Below the cricoid and above the clavicle there is level 4. Now when you see level 5, now 5A and 5B I said, so those which are present in the F triangle, which is the supraclavicular triangle, those are supraclavicular group of lymph nodes also called as level 5A. And then in E you have occipital group of lymph nodes also 5B. Now level 6 is your pretracheal and paratracheal group of lymph nodes. See, head and neck drains into your these levels 4 and 5. But there is thyroid, there are other tumors in the neck that will drain into your pretracheal and paratracheal group of lymph nodes. For example, supraglottis of the larynx, that will drain into your prelaryngeal and pretracheal group of lymph nodes. So this collection of lymph nodes is now level 6. Now what is level 7? Level 7 is your mediastinal group of lymph nodes, and then so on. But for head and neck we have classic 7, or if you want to include mediastinal you say 7 plus 1, which is 8 group of lymph nodes. Now why am I talking about the lymph nodes in detail in the neck? See, we talk about lymph nodes when we talk about certain anatomy, specifically when we talk about malignancy. So we know the most common malignancy in the world is lung malignancy, right? And the second most common malignancy in the world is oral cavity, which is head and neck. Now in India the trend is a little reversed. In India the most common malignancy is your oral cavity. Oral cavity, when we say, we talk about the tongue, we talk about buccal mucosa, we talk about gingiva, we talk about mandible. So basically oral cavity malignancies in India is very prevalent, obviously because of reasons like tobacco chewing, we have betel nut and all that. Because of that over here lung ke upar apna oral cavity malignancy hai. Now cancer has a tendency to spread, right? So cancer can spread via two modes. There's a hematogenous spread and there's a lymphatic spread. So a lot of cancers in our body, for example lung cancer has a propensity to spread via hematogenous route. But oral cavity malignancies, they have a tendency to spread via lymphatic route, right? That is why it's very important to know the levels and the anatomy of this lymphatic system in the neck. So for example, if you have a malignancy tongue, now I know tongue drains into level 1A, 1B and level 2 primarily. So those nodes will now be called as sentinel group of lymph nodes, because those are the first nodes which will be involved if ever. Then from 2 it will go to 3, 4, 5 and so on. So what I'm trying to say is, understanding the levels of nodes will tell you indirectly at what level of disease is there in the body. For example, if you have when we talk about malignancy, there's something known as T, N and M. T is tumor, N is your node and M is your metastasis. When we talk about metastasis, it is your distant metastasis. So there is cancer by the definition spread, right? It is uncontrolled division of cells. So it will infiltrate your surrounding structures. So there's loco-regional spread and there's distant spread. So loco-regional spread will classically include your nodes. And the distant metastasis will include your lungs, your liver and all of the other organs. So T, N and M. T is the tumor, in which we talk about the primary disease, the size, the depth and the extent. Then N is your nodal status, how many nodes are affected. All of this will tell you at what level of treatment will be required for this patient. So for example, you need to know, see, we always learn about the blood supply and the nerve supply of any structure, but we rarely look at the lymphatic drainage. But in oral cavities and more specifically in head and neck, we have to understand the lymphatic drainage more properly because of the reasons I told you right now. So for example, if there's a malignancy of the ear, where will it drain? In the preauricular and the postauricular group of lymph nodes. Similarly, malignancy of the buccal mucosa, where will it go? In the level 2 or level 3. So a lot of time what happens, you examine a patient, you will see, oh, there is a malignancy, you've done a biopsy, it's come positive. Now you're trying to look for the nodes in the neck and it's negative. That means there is no palpable group of lymph node in the neck. Now you'll get a CT scan done, you'll get an MRI done to see the node. Now you see that on the CT you'll find subcentric group of lymph nodes, or you'll find small lymph nodes which are not turning malignant as such. But still, because we know that the cancer of the oral cavity spreads via lymphatics and the tendency is over 90%, we will still do a neck dissection with our primary resection. That is the reason we need to know the levels of the nodes, so that we know till what level we need to do the neck dissection, right? So classic neck dissection, like I said, there are 7 group of lymph nodes, but when we do a classic neck dissection, which is known as radical neck dissection, this is your applied of the anatomy. So in anatomy we spoke about the triangles, then you know the contents of the triangle, then we spoke about the level of the lymph nodes. Now I'm telling you, why do we need to know all of this? So I'm giving you a clinical scenario. In this, there was a patient who was T2, that means the lesion is about 4 centimeter. You saw the neck, there was no node. You got a CT MRI done. You could not find any malignant changes in the CT in the node section. So now what would you do? Would you simply excise the lesion and get done with it? No. Over 90% of the time, the malignancies of oral cavity has a tendency to spread via lymphatics. This concept is known as micrometastasis. That is, even when it is not clinically evident, almost 90% of the times you will find a micrometastasis in the lymphatic channels. Therefore, when you have a T1 lesion, you can still get away with it. But in T1 above, that is T2 lesion, you have to do a neck dissection. When I say neck dissection, I say dissection and removal of your lymph node levels. Now we know there are 7 group of lymph nodes. Now we can't remove all the levels for every patient. That is why we need to know which organ drains in which particular lymph node, so that we can do that particular lymph node block dissection and get done with it. For example, if that also comes positive, then we'll further go for a more advanced dissection. Are you getting what I'm trying to say? So in a classic neck dissection, for example, it's a T4 disease, advanced malignancy, we do a radical neck dissection. Radical neck dissection is you remove level 1 to 5 group of lymph nodes along with sternocleidomastoid, in spinal accessory nerve and internal jugular vein. So these are the structures that you remove in a radical neck dissection. Now, for example, if the malignancy was not that advanced and you saw CT made the sternocleidomastoid looks normal and there is no big node, then what can you do? You can preserve structures, right? So then now you will start calling radical a modified radical neck dissection. So in a modified radical neck dissection, again based on the structures that you're preserving, you will call it MRND type 1, type 2, type 3, which is not what is relevant to you right now. But knowing the nodes of the neck is important, because that will tell you at till which level you need to do the neck dissection in cases of malignancies of oral cavity, right? Now, apart from the nodes, what other structures are present in the neck which are of clinical significance right now? So you know there's trachea, there's esophagus, there's a detailed anatomical class on each of them. But what you won't get is the muscular structures of the neck. See, like we said, there is a muscular triangle in the neck. इसमें से muscular triangle कौन सा है? D. Yes. So muscular triangle का content क्या होगा? Like the name suggests, the muscles. So you have strap muscles. Now, does anybody know what are strap muscles? Anatomy तो पास किया है ना? So you should know what are strap muscles. So strap muscles are ribbon-like muscles which are present in the midline of neck. There are 2 groups of strap muscles. The supra-hyoid and infra-hyoid group of strap muscles. Now, infra-hyoid group of strap muscles is what makes the content of your muscular triangle, right? Now, what are the 4 infra-hyoid muscles? Anything which is present between the hyoid and structures below. For example, sterno-hyoid. sternothyroid, thyrohyoid, and omohyoid. So these are the muscles which are the intra-hyoid group of strap muscles. Now what is the nerve supply of this group of muscles? Ansa cervicalis. Yes. So why am I talking about this here? Because the anatomy, the triangles of the neck are classically divided by this muscle, which is omohyoid, and the other muscle is posterior belly of digastric. So from the neck perspective, you need to know two muscles which are very important. One is your posterior belly of digastric, and the other is your omohyoid, which is the intra-hyoid group of strap muscles. Now, posterior belly of digastric is उसका origin क्या है? देख के बता दो. Mastoid, mandible, ear, skull. It is the mastoid tip, है ना? So the origin of posterior belly of digastric is mastoid. And what is the insertion? Hyoid. So anterior and posterior belly of digastric forms a sling. ठीक है? This is a tendinous sling, if you can see near the hyoid. So you know, right? Hyoid bone में एक lesser cornu होता है, greater cornu होता है, एक body होता है ना? Mostly all the muscles which are coming from above downwards will get inserted into the lesser cornu of the body. And all the muscles which take origin from the hyoid will take from the greater cornu of hyoid and will go henceforth. The basic dictum hai. So if you see here, posterior and anterior belly of digastric are forming a tendinous sling. And where are they getting inserted? At the body and lesser cornu of hyoid. Now, why am I saying this is because again, this particular muscle is dividing your three triangles. It's dividing your submandibular from your muscular. It's dividing your muscular from your carotid, and it's dividing carotid through your posterior. So posterior belly of digastric is a very important muscle because it is also a landmark for a very important nerve. Facial nerve, right? So when we do a parotid surgery, when we do a neck dissection, we always look for facial nerve, and one of the very important landmarks for finding and identifying facial nerve is posterior belly of digastric. Similarly, omohyoid defines your limit of neck dissection. Can you see this muscle which is coming from the hyoid below? That is your omohyoid. Now, omohyoid is divided into two bellies. There's a superior belly and there's a inferior belly. Now, this muscle is also important because again, it is dividing your neck and the level of nodes. This gives you the extent of dissection in the neck. And then there is carotid sheath. Now we know carotid sheath mein there's common carotid artery which is dividing into internal and external carotid artery. Okay, we did not talk about the cervical fascia, which is also one very important anatomical aspect of neck. वो एक ये मनूस diagram जो कभी याद नहीं होता. So the cervical fascia is divided into two layers. There's superficial and deep. The deep is again divided into three layers: investing, prevertebral, and pretracheal. So you will have to mug up this anatomy because इसका और कोई चारा नहीं है. But the important part over here I'm trying to tell you is when you talk about the deep layer or the investing layer of deep cervical fascia, this particular layer is very important when you talk about the surgical anatomy. Why? Because if you want to remember, I don't know, think about your anatomy classes, two spaces, two glands, all encased by this one particular fascia. Rings the bell? No? Okay, so deep layer, investing layer of deep cervical fascia invests two muscles. We spoke about it. Posterior belly of digastric and sternocleidomastoid. Two glands, submandibular and parotid, and two spaces, suprasternal space of Burns and supraclavicular fossa. So this space is important because these are the potential spaces. Potential spaces matlab they're not actually there, but they have a tendency to develop if there's any tumor or if there is any lymph node enlargement. So from my side, this diagram is important. It might be asked in your exams and you'll have to mug this up. There's no other way out. I already told you about the anatomy of each cartilages. इट्स बेटर. यार देखो ऐसे तो बहुत लंबा है, इट विल नेवर गेट ओवर, बट आई एम ट्राइंग टू टेल यू द. ठीक है, डीप सर्वाइकल फेशिया के 3 लेयर होते हैं, ये सब पढ़ लेना एनाटॉमी से. बीडी चौरस क्या वही पढ़ते हो? हाँ उसमें है. अटैचमेंट ऐसा नहीं है ना, एनाटॉमी खत्म हो गई तो ये नहीं पूछेंगे. दिस विल बी आस्क्ड इन ईएनटी आल्सो. वी स्पोक अबाउट lymph nodes also. ठीक है, pretty much it. Is there anything you guys want to ask which you didn't understand, so then I can explain that in detail? ठीक है, अटेंडेंस हो गई.